I'm Dr. Tracie Afifi, and I'm a researcher at the University of Manitoba. I'm happy to be the recipient of the 2018 Royal-Mach-Gaensslen Prize for Mental Health Research. One of the things we need to do is make sure that preventing child abuse and neglect is a priority in Canada. We need to educate Canadians that child abuse and neglect is prevalent in Canada and that it's related to many poor outcomes for children. So we need to continue to understand the size and scope of the problem. We need to make sure we're staying innovative in our strategies to prevent child abuse and neglect, and we need to make sure that what we're doing is working.
Dr. Afifi's research is extremely important because she's really showing the importance of child abuse and spanking and physical punishment being linked to a range of mental health outcomes across the lifespan. One of the areas that's really controversial and important is the issue of physical discipline in the home. And that's one of the areas that she's really done a lot of internationally renowned work in.
So our research on spanking has shown that spanking is actually similar to experiences like physical abuse and emotional abuse. We've also found with our research that individuals who experience spanking were more likely to have problems with alcohol, to use drugs, and also to attempt suicide. So unfortunately in Canada, there's a law that actually allows children to be hit. Repealing Section 43 of the Criminal Code of Canada would allow us to identify families who would be at risk for maltreatment earlier. It would also help us to shift the culture in Canada away from one that tolerates violence against children. Currently, a large focus of our work has looked at how we can foster resilience following child maltreatment. So we're looking at things like protective factors and what's related to better outcomes for children. I wanted to become involved in Snowflake Place because it's a really unique place in Manitoba where children can disclose their abuse in a safe environment with highly trained experts. I serve on the board at Snowflake Place, and I'm also involved with program evaluation and fundraising.
She's a warm person. She is very approachable. When she came to the board, she was very interested in the work that we do and very supportive of our practices and really wants to help us to be better at helping children who are impacted by abuse. Her work is really important because it helps to raise awareness of this issue. The level of awareness and understanding of child maltreatment in our community is lacking. And the more we know about it, the better we can help, and the more resources, hopefully, will be put into addressing this issue.
Dr. Afifi is an excellent fit for this award because she has been an outstanding star in mental health epidemiology. She has really worked on developing interdisciplinary teams that really look at the issues from various different angles. But also she's been outstanding in her ability to present the information locally and nationally in a clear manner such that people listen and are willing to make changes around her work.
This work is really important to me because I believe if you can prevent child maltreatment, you can change the trajectory of a child's life and reduce mental health problems.